healthcare corridors to kitchen tables, this topic, prioritizing health for women and the rising burden of fertility, emerges as both urgent and pivotal. From shifts in lifestyle, environmental factors, delayed childbearing, and socio-economic pressures have contributed to a growing burden of overall health and fertility issues among women worldwide. We have a brilliant panel to share the many aspects of this discussion. Please welcome the panelists. We have Shivani Bajwa, CEO, founder, Yoga Sutra Holistic Living. Dr. Neema Sharma, Director, Unit Head, Obstetrics and Gynecology, Fortis Hospital, Vasant Kunj, New Delhi. Dr. Preeti Khanna, Nutrition Expert. And Dr. Niranjan Hiramat, Senior Consultant, Cardiovascular and Aortic Surgery, Indraprastha Hospital. So join us as we cut through the noise and tackle the tough questions with our esteemed jury. So Dr. Neema, my first question is for you. As from your perspective as a doctor, what are some of the key health challenges that women face today, and how have these challenges evolved over the recent years?
Yeah, thank you. Thank you for inviting me here. Now the question is the health challenges faced by women today. I think there are a lot of health challenges which we need to discuss, starting from young age group. Let's start with teenagers, adolescent groups. They are having health issues with lifestyle disorders like polycystic ovarian syndrome, in which they are struggling with weight gain, acne, facial hair, psychological impact which is happening to them. Then the younger age group struggling with sexually transmitted infections, HPV infections, unwanted pregnancies, rising rate of infertility, endometriosis is rising and is evolving over a period of time. So there's a long list of problems which are happening. Now in the middle-aged group, you start having a lot of ladies coming with abnormal uterine bleeding, and they sit at home. And they come to hospital when they have severe anemia, in which we have to transfuse blood to them. And this is happening in this era also. Yeah. In the older age group, talk about menopausal symptoms. But now people are more aware. They are not sitting at home with menopausal symptoms. Yes. If they suffer, if it is affecting their quality of life, they are coming to us. And it's important to discuss all these menopausal issues because we have treatment for it. We have menopausal hormonal treatment for all these problems. Yeah. And last, the rising incidence of cancer. Yeah. In fact, one of the National Cancer Registry showed about 9 lakh plus cases, new cases in 2010. And there were about 11 lakh cases in 2020. So rising cases, but it's important to prevent all those cancers which can be prevented, which we need to stress upon, like cancer cervix, which can be prevented by giving a vaccine to all young girls, to all young people before 26, and do regular pap smear screening so that we can prevent this cancer and breast cancer by doing regular screenings. Yeah. So I can go on, but you please.
No, that's okay. But I feel that the issue of cancer has been so common and it's been on the rise, and there is a lot of need for us and healthcare experts to talk about it in detail. My next question is for Dr. Preeti Khanna. From a nutritional standpoint, what are some of the key factors that women should consider when emphasizing their health and fertility in specific?
Thank you for the question. And as ma'am just quoted a lot of data and the current problems that our current women in India are facing, it becomes of paramount importance that we give due importance to the nutrition and the food that we are eating in our daily life. And I have been a preacher and a practitioner of the traditional Indian diet. And again, going back to our roots in the kitchen and opting for healthy recipes and going back to the traditional Indian food. So अभी धीरे धीरे क्या हो गया, जो भी सब कुछ ब्राउन था सब वाइट होता चला गया. आटा था मैदा बन गया है, ब्राउन राइस था वो वाइट राइस हो गया है, ब्राउन शुगर वाइट शुगर. तो धीरे धीरे ब्रांड फाइबर डाइट से निकलता चला गया है. एंड उसकी वजह से जैसे मैम ने बोला, बच्चों में ही पीसीओडी आजकल बहुत ज़्यादा है. और वो क्यों ज़्यादा है? क्योंकि अल्टीमेटली हम जो खा रहे हैं इट इज़ ऑल रिफाइंड फूड. So again, we need to go back to our traditional Indian dietary practices, where our thalis, used to be very colorful representing all the different food groups in the right amount, along with water and our, traditional beverages like chach, lassi, kanji, which is again a fermented beverage. So that needs to be taken care of. Yeah.
I feel portion control is the key when we talk about nutrition in specific. So my next question is for Shivani. Shivani, the chatter of gut health has been there forever, and especially when it comes to women. Women is the, like, this gender is the first one to basically not prioritize their own food intake, their own nutritional needs, because they overlook their own needs over their families. So how can such negligence make an impact on their health in a longer run?
So as Dr. Nima and Dr. Preeti said so rightly, that of course we've identified the diverse issues we have, of course. Then of course how nutrition plays a key role, and the intense chatter about gut health today. But the interesting thing is how gut health generally impacts a lot of other systems, your neural, your endocrine systems and everything. But I'm just going to take it and unpack this as a case study for women in the audience as well. So if you have someone between 35 to 45, because as I see that's what we're getting here. So adrenal burnouts are common, right? Too much responsibility. What is the one hormone that then gets spiked or imbalanced is normally cortisol. Now, if we just in a functional medicine perspective, how we investigate this, just one particular line, there are many ways to look at it, but just one to just bring your attention for women is when you have burnouts and cortisol goes up, your body fat stores go up, insulin goes up, right? And today's discussion is all about the rising epidemic of insulin resistance and mostly how this now is going to affect the way you metabolize glucose in the body. And excess sugar reserves or excess body fat reserves, now where does that lead a woman in this age group? Of course, there could be clogging of estrogens. So we have the imbalance now of a sex hormone that clogs up your plumbing, your filtration system. That's how I look at it. So look at the hormones that have been touched, the cortisol, the estrogen, thyroid gets impacted. So if you just look at now a woman, and I always tell my mom, the glass is lying like this, why do you have to OCD put it there? This is the hormone cortisol going crazy in your body, and now you're going to become fat. She'll just stop. Because the minute you say cortisol bumps insulin, it all sort of just falls into place. And so if you want to really untie this, work on the nervous system, most importantly, and give yourself a break often, and focus on bringing in a lot of oxygen in bits, and that's the way to sort of unpack it at the easiest right now.
So, like Shivani said that whatever we eat, what we eat is how we feel from the inside. My next question is for Dr. Niranjan. How do lifestyle factors such as diet, exercise, and stress management impact the cardiovascular health in women? And what are some of the specific risks that women today face, and especially during their reproductive years?
Excellent question. First of all, thanks for having me here. And it's my pleasure to be a part of this panel. Continuing where Ms. Shivani left off, is that cortisol level, increase in cortisol levels tends to increase your cholesterol levels eventually, causes a lot of pro-inflammatory reactions in your blood vessels, which you mentioned as plumbing. So I'm a plumber here. And so what happens is it irritates the lining of the blood vessels and causes cholesterol depositions, which basically in layman language increase risk of heart attacks, and cardiovascular risks go up. So many people think that these are diseases of the old, but it's very important to understand that these things start very early in life. They build up over many years, and they eventually manifest at a much later stage. About 15-20 years ago, it used to manifest around 50s, 60s, and they used to call it old people's disease, right? But then now you're seeing 20s, 30s having heart attacks, and of course you have genetic factors, environmental factors, but you see smoking on the rise, you see bad diet, you see increased stress levels at very young age. So the damages start happening much earlier in the teenage age group and young adults. And it's just multifactorial. All of it comes together and eventually manifests in 30s and 40s. Diabetes was even unheard of in the 30s, 40s. I'm not talking about type 1 and things like that, but lifestyle-based diseases. and high cholesterol levels. I'm seeing people right now in my practice, 25 to 35, with uncontrolled high blood pressure, uncontrolled. I'm talking about 200 by 120 and so on and so forth. And I'm seeing high cholesterol levels. And these patients are all sitting ducks for cardiovascular problems, which is basically heart attacks. And so I think it's very important to understand that, okay, let me see when I get to 40 or when I get to 30 and then I'll start exercising and change my stuff. No, things start right from the younger age group, and we need to start making these changes much earlier. And when it comes to women, we have to understand there's a very important point I would like to make when it comes to women's heart health, so to speak. The younger age group, especially in the reproductive age group, they have the estrogen plays as a protective hormone against cardiovascular risk factors. That doesn't mean it eliminates it. That means the ratio of a woman having a cardiac problem is 1:3. That means every 3 men, and then 1 woman has a problem. Yeah. But it increases 3-fold the moment she hits menopause, which means there is accelerated cardiac problems or risk of heart attacks after menopause. So it pretty much makes up for the protective period that you have. Yeah. So, and I don't want to keep going on about it, but this is a very important thing to understand, that not everybody is just protected. Many people have just half of the information that, okay, I'm protected till I'm like this, but then imagine you've had a bad lifestyle, bad diet, stress, everything, you hit menopause and boom, you're like 5 to 10 times higher risk factor.
Can I add one line here? Now, as he mentioned, with menopause, your risk of cardiovascular diseases increases. I want to bring out one important point. Every woman, if she attains menopause early, that's called premature menopause. Menopause at the age of 40 or even less than 45, she should consult a gynecologist, because it's important to give hormonal treatment till the age of 50 so as to decrease all these risks. Risk of osteoporosis, but important, as Doctor mentioned, risk of cardiovascular disease. So premature menopause should not be left. Earlier, nobody was talking about it, but it's important to give hormonal treatment till the age of 50.
So just what Dr. Niranjan also said, that bad diets, bad lifestyle, all of that has a great impact on women's health. So just I would like to know your point of view, Shivani and Dr. Preeti. How can a bad lifestyle, crash diets, sudden changes in diets, how can that impact overall health, especially and specifically in women?
It would do that for both genders. Yeah. And rightfully so, if you're going to have anything that is not sustainable, then it's going to, like you said, imbalance some hormone or the other and put you at a risk where, like I said, if there is one condition, it does trigger many others. So I think it's just normally this specific question would be that, like he said, today the idea is that we are seeing PCOS, endometriosis, we're seeing infertility, the rise of perimenopause and premature menopause happening too early. Yeah. Everybody says, why do I have my hair graying also so fast? So somewhere the biological clock of the body is not working on time, and that's enough hint for you to understand one key thing. The body is inflamed. There's inflammation, and these signs are key to pick up on and get your act together, be it through exercise or diet, and then everybody has their own version of it. Someone wants to do Ayurveda and yoga, someone wants to do keto and whatever. Please feel free to do it. It should be sustainable, but it should be regular, consistent, and should be something that you can pull off. Yeah, that's it.
Dr. Preeti? Yeah, so just to add on to what she was discussing about inflammation. So yes, definitely yes, our bodies are already in the state of inflammation. Another point is that the consumption of inflammatory diets has also increased. And that again includes HFSS foods. To break it down, high fat, sugar, salt foods. And again, covers the gambit of junk food and all our Indian, snacks समोसास कचौड़ीज जिनको हम बोलते हैं कि ठीक है हमने इवनिंग में खा लिया तो खा लिया, बट ऐसे नहीं होता है. दे all together come under the gamut of HFSS food, and HFSS foods again make our food as well as our bodies prone to inflammation. And during COVID, you know, inflammation came out to be the key term, the buzzword, कि body में बहुत inflammation है. तो अगर आप सोच सकते हैं कि COVID के टाइम पे inflammation थी बॉडी में और इतना इम्पैक्ट आ रहा था कि पीपल वर लूजिंग देयर डाइट्स. सो इफ वी आर कंज्यूमिंग इन्फ्लेमेटरी डाइट ऑन अ डेली बेसिस एंड पुटिंग आवर बॉडीज you know in that inflammatory state on a daily basis, so what are we doing with ourselves is something we need to ponder. So that's something that needs to be taken care of.
Dr. Niranjan, okay. And you wanted to add something to this?
I wanted to say something about light at the end of the tunnel in the form of exercises, but I'm not sure if you have that question on your thing, so I don't want to steal your limelight.
That's okay, that's okay. You can add your point. Or
no, there was, we are talking about bad diets and bad lifestyle, and but there's a new study that has come, in fact, hot off the press just yesterday, published by Siddha Senai. Women have an advantage when it comes to exercising. Did you see that? Yeah. Exactly. So 30 minutes of exercise for a woman, we are talking about moderate to intense exercise. 30 minutes of it is equivalent to a man doing 1 hour of exercise. Okay? Which means that, given that women are usually multitasking masters, and time on their hands may be a little less, and we know that many homemakers or career women, they keep mentioning about lack of time, we have to balance family and work and so on and so forth. Well, here is a study that says you exercise for 30 minutes, that's enough, spare 30 minutes in 24 hours, and you reap double the benefits.
I think that's a very good news for women all over here. So yeah.
It's always easier to lose weight for men. That's what we always say.
Yes.
That's just the truth.
Yeah. So my next question is for Dr. Neema. What are the primary factors contributing to the rising burden of fertility issues among women, and how do societal norms and lifestyle choices impact the fertility rates?
Yeah, so definitely infertility rates there's been a rise, and a lot of patients are coming up with these issues, but we have to understand what are the reasons for it. First to begin with would be late marriages. And even if they get married, they don't want to plan pregnancy early. And the problem is, they have to understand, as she mentioned, that there is a biological clock which is there. And as the age advances, the number of eggs will fall, the quantity will fall, the quality of the eggs will fall. And all the studies have stated that after the age of 80, the number of, after the age of 30, the number of eggs fall, and after the age of 35, there's a drastic fall in the number of eggs.
Yeah.
So this, I think every woman should be aware that if they have to plan a pregnancy, it should be at the right time. So first thing was, because late marriages are happening, they're delaying their pregnancies. Some of the couples, they don't want to plan a baby.
Yeah.
They are so busy with their careers, they don't have time with each other. Important statistics is 80% of the couple conceives in 1 year after staying together regularly. And 90% couples conceive in 2 years if they stay together.
Yeah.
But nowadays they are not staying together. I mean, they are in different professions, different places. So that is another reason. Stress is another reason. Because of the stress, there's so many hormonal things which are happening. The periods get delayed. And then there can be lifestyle factors like smoking, alcohol, addiction. All these things they are causing decreased fertility.
Yeah. Yeah.
So I think these were the common reasons. Yes, another thing is weight. Overweight will cause hormonal imbalance, will cause difficulty in conceiving. And there are other group of people also who are into a lot of exercises.
Yeah.
The condition called anorexia nervosa, they won't eat, they want to reduce weight. That is also causing problem. And that is also causing difficulty in conceiving. So I think these are the common reasons why infertility rates are increasing.
And I feel especially after COVID, there was this influx of everybody exercising, going on crash diets, and like just trying to change the way they look. I feel that greatly impacted their overall health, which has amounted into the number of cases of cancers or maybe heart attacks of what we are listening to these days. So Dr. Niranjan, I would like to know your view on this. We have heard so many news, so many instances or cases of famous personalities losing their lives because of heart attacks and cardiac arrests. So why is it that it is only the age group between 35 to 45? Because most of the cases were between 35 to 45, not more than that. So are there any specific reasons or maybe any concerns that people should know that, okay, these can be the certain factors that could contribute to the rise in such cases?
This is one of the most common questions being asked recently in my practice. Look, I think the diseases have always been there. Young people have been at risk. Obviously, the manifestation is much more lower right now, and thanks to COVID, because there have been hundreds of studies after the pandemic hit us, that the intensity of COVID infection, or the fact that any person who gets COVID infection is suddenly 14% or 20% more at risk of getting sudden heart attacks.
Yeah.
And this is without age relation, you know. In young people as well, we are seeing it more often. Now, you combine it with bad lifestyle, then, you know, during the pandemic, 1.5 years, people didn't move about a lot, bad diet, stress, and then now you add COVID to the mix, it all starts manifesting. That's number one. Second is that many a times, there are genetic risk factors that many people are not aware of.
Yeah.
Every patient who comes to me and they ask, what is the first thing I should know? I'll say, first know your family history.
Yeah.
Know whether your father, mother, your siblings have had heart problems. Because that's, I feel, right at the top. And studies have shown that genetic factors play a huge role on what you get next, right? And accelerated atherosclerosis, which is basically fat deposition in your body, including the arteries, has also increased, especially in the post-COVID era. So all of those are contributing, plus media awareness. There have been deaths in the past. It's not that it's not been. I know quite a few people, young people, who have died even before the COVID era. It's just that these things didn't come out before. And now it's more social media awareness and more sensationalization and so on and so forth. So, you know, it's multifactorial. But yes, there has been a rise, and it's alarming. And I think the important thing to remember, especially for youngsters, to be really self-aware. Self-aware. That really is the key word. Know yourself before you venture into diets or exercises or whatever.
So my next question is for Dr. Preeti Khanna. Like Dr. Niranjan said, that people need to be self-aware. So what dietary changes women should make in their lifestyle to address a lot of these challenges that we face? Like we said, we discussed about PCOS, we discussed about fertility and heart problems. So what are the changes that women should make in their daily lifestyle?
I think that's one of the most important questions for today's discussion. So when it comes to the diet, again, being mindful of what we are eating is, you know, something that we all need to be very concerned about. We being the women, and we know that, you know, we have the power to bring a life into this world. And like, you know, just Dr. Nima was quoting that the fertility problems are increasing, and one of the major reasons contributing towards it is definitely diet, and the kinds of diet that we are currently consuming, again, which contains a lot of sugar, fat and salt, HFSS foods. They are of concern. Why? Because, you know, when the dietary fiber from the diet is lost, ultimately all the food that we are consuming will impact our hormonal changes as well. It will definitely make women more prone to being fat. It will definitely make more prone to being obese, and obesity itself is you know, a gamut of diseases. And with obesity rises the incidence of diabetes, CVDs, thyroid, etc. So again, we need to be very careful. We are, you know, planning our diets in such a way that our major meals, which is our breakfast, lunch and dinner, they have the right proportion and the quality of both carbohydrates and proteins in a balanced form. So overdoing anything is definitely not the criteria, but maintaining the right amount and quality is something very important. Inclusion of omega-3 rich foods like seeds, plant seeds, your flax seeds, sunflower seeds, melon seeds, they go a long way in enhancing the antioxidant properties of our diets, and also protect our bodies from various CVD diseases as well. And omega-3s can also be found in fish oils, so anybody who's from the non-vegetarian group can definitely go for fishes and the seafood as well. Last but not the least, including a lot of vegetables in the diet and going less on carbs and substituting carbs with millets. That can go a long way because millets are very rich in fiber as well as micronutrients like iron, folic acid, zinc. And like we all know that, the incidence of anemia and micronutrients is very high among the women. So these can be taken as steps towards improving the quality of diets that we are currently consuming.
Great insights by Dr. Preeti. So, Shivani, there's more than just what we eat to stay healthy. Can you elaborate on the role of holistic practices in promoting women's overall health, including stress management, immune support, and enhancing vitality?
I think we all are exposed to the basics. We all know we need to exercise, eat right. Someone says do yoga. Often when I'm in the context of functional medicine, dealing with people, the only thing is that we already have very, very smart people coming to this program. They already know it. I think everybody in the audience already knows this. So if I just have to go a little beyond what's working for me, and just specifically for me, is that when we really just suggest something called using 10-minute capsules in the day, because as Dr. Preeti rightfully said, was that we are dealing with an extreme culture where people are excessively gymming, excessively eating right, excessively frying over Zempics today as well. So we also have really, really wired people who are apparently doing it all right and then saying it's not working. So my thing with them has always been, cut the gym out for 1 hour, okay? For 1 month, we're only going to do 10 minutes of you going out in the sun. We're going to start using one yoga bolster for restorative yoga because we need you to calm down first. Nothing is going to work if you're not going to learn the art of that. So I think we are also dealing with self-esteem issues and many things in this. So also too is to get to a job and not worry so much about the way you look and what you're eating. That also builds a lot of nervousness. But 10 minutes in the morning, I call it a biohack. Biohacking is a common word used today. We're hacking our health through easy 10-minute techniques, which are way more effective in cortisol and insulin control today. So get into restorative yoga practices. I'll urge everyone to just get one prop, which is called a yoga bolster. It can set your BP, your metabolic lifestyle disorders within 10 minutes as you wake up. And 10 minutes before you go to sleep, if you can put your legs up on the wall, specifically for a woman, I would say, if we're talking about women's health, our main stress is held in our pelvic and our legs. We are always going to be tired here. So if we can bring back the blood into our legs, we will sleep right, of course. But often in Iyengar yoga, as I've studied 2 or 3 schools of yoga now for 15 years, I can tell you the one trick that genuinely works in this whole thing is for a woman is to tell her that if your legs are strong, your mind is strong, you know. So she's got too much responsibility to focus on restorative practices only for a few months. And take it easy. That would be the advice. Yeah.
Okay, so these were some lovely insights shared by our experts. I would just like to know a last word on this topic as a whole, as to how women of today can ensure that yes, they can live healthy, they can live well, and they can also ensure that they're healthy in future. We can start with Dr. Niranjan or Dr. Neema.
See, from a doctor's perspective and heart surgeon's perspective, I can tell you that after listening to all the expert panels here, I think the message is moderation, and again, I would like to reiterate self-awareness. What I mean by that, and I would like to expand that word that I said, is that, you know, first focusing on ourselves, and then the career, and then the family, and you know, even if it's 10 minutes for that matter of fact, that's a great start. And you know, we realize all of a sudden that there's so many things we can change within ourselves, and you know, that actually has a big impact. And for example, I always tell my patients who come to me, I said, look, get 10,000 steps in every day. You know, that greatly reduces your risk of having heart attacks. One of the most common thing, apart from diet and lifestyle and everything, is the lack of not moving enough. We are at desk jobs, or, you know, I remember my mother always used to say, I work so much in the house, do you think I need exercise? Well, the work that is done in the house as household chores is actually passive working. You're not focusing on yourself. You're not focusing on your posture, breathing, so strength, so on and so forth. You're just working because you have to do it. But then when you actually focus on yourself and exercise, you're correcting all those things that are not there otherwise in day-to-day life. And that plays a huge role in decreasing your stress levels, your hormones, your cholesterols, your risk factors, and everything. So I think it's important to focus on self.
Yeah, so I think prevention is better than cure. So from gynecological point of view, if we talk about prevention, again, I'll start with cancer cervix prevention. Yeah. So please, it's important. Media plays a very important role in creating awareness about HPV vaccine for all young girls and regular pap smear screening to prevent cancer cervix. Actually, this is the only cancer which is preventable. Yeah. We can prevent, none of the other cancers are preventable. Yeah. So this is the only cancer which is preventable. So it's very important to create awareness, and now people are coming up. They are asking for vaccines, they are asking for regular pap smears, regular mammograms for breast cancer screening. Yeah. And just we were talking about delayed, couples are not planning pregnancy now. So an important point to tell is that if a couple doesn't want to plan pregnancy right now, or they want to delay their pregnancy, there is a facility for egg preservation. Yeah. They should, it's very important that this should be done. This is because later on, whenever they are ready, they'll have their own eggs and they can have their own baby. So that is another important thing which I want to bring it out.
Shivani, if you would like to. As a whole, how women today can ensure that tomorrow they can live healthy, today they can take care of themselves. So your parting notes at the end of this
The last
session.
one was pretty much that, but just, I just genuinely feel they're expecting too much from themselves. Yeah. So I think perfection is the issue here, and I see it every day that when we just let them breathe a bit and say that it is not expected of them. There are lots of diseases and inflammations and fires we're dousing. Yeah. So I think the most important thing is to be kind of a little nicer to yourself at this point. I think that is the core of most diseases. And the autoimmunity that's getting set in post-COVID, every problem is boiling down to the immune system not working or the mitochondrial function being an issue. So I think simply just keep rewiring the nervous system, and you would be, you know, in the space of prevention more than cure, and that's what we kind of hope for everyone here.
Dr. Preeti?
I guess moderation definitely is the key, and like Dr. Neema was, you know, quoting that we need to take prevention as the key, and definitely yes, with the rising awareness regarding the HPV vaccine, we all need that kind of protection, and we women in today's century are very lucky that we are born in this era where prevention is available. So let's utilize that techniques. We have preventions from dietary disorders, we have preventions from, you know, cancers today. So being aware and keeping a constant check on one's health, whether it is something, you know, that is hampering my mental state or my physical or emotional well-being, that is something that women really need to be, you know, concerned about, because with the rising stress that we have at managing homes and work, it becomes a constant, you know, war between oneself, that whether I'm giving my best to my family or at work. So maintaining that mental balance is something very important. Yeah.
Thank you so much, panelists, for being here with us and sharing your insights with the whole group over here.